I'm curious for other sort of historical examples of the PRC being really stubborn when it comes to kind of sort of nationwide medical decisions.
Mhm.
What comes to mind?
Well, I think there are two examples that come to mind, and both of them draw on work by colleagues of mine. So one is the Eltor cholera outbreak in the 1970s in China. And this is something that my colleague Fan Xiaoping has done some work on. He's looked at kind of ways in which that responses to that cholera outbreak really stressed the need to significantly control information, even going to the lengths of having epidemic response teams only refer to cholera in code. I think it was called disease number 10 in communications, for example. There was also a strong emphasis on surveillance of diseases, of blaming infection and introduction of infections on immigrants. At the time, there were, I believe, migrants coming in from Indonesia as part of various programs. So, with the El Toro cholera outbreak, you maybe see examples of commitment to a particular way of epidemic response that involves strategies that might seem familiar to us now. State surveillance, concerns to control information, things like that. Um, that said, a lot has happened since the 1970s in China. And so I think we got to be careful about the degree to which we see historical connections over those decades. And so the other case that I think is probably a bit more relevant, and if we're thinking about ideas of stubbornness, um, it's actually not so much stubbornness. It's about attempting to change efforts to change that then cause problems, if this makes any sense. So I'm thinking of Catherine Mason's work on Chinese epidemiology after SARS, looking at the period from around 2003 to 2010, and her ethnographic work following CDC, Chinese CDC staff during that period. So I think probably most people assume that the first SARS-CoV virus that the world experienced in 2003 was, it would seem natural that that would be important and influential on Chinese strategies of public health for COVID-19. But I think the thing that Catherine Mason's work really speaks to is the fact that China was already in the middle of moving to a new model for epidemiology when SARS broke out in 2003, of moving to a CDC American model of epidemiology. So that epidemic breaking out really gave a ton of momentum to reforms in epidemiology that were already underway. And the result was a really beefed up epidemic response strategy that took really seriously the need to isolate infected cases in a new pandemic, exert rigorous quarantines. And so we see that model emerging. We see it being tested for the first time in 2009 when swine flu breaks out. And that leads to unintended consequences as far as Chinese epidemiology is concerned, because their implementation of those methods doesn't lead to praise from the international community of global health. It doesn't lead to full acceptance in that community of global health as modern, competent experts. Instead, China simply comes under fire for overreacting
Yeah.
in the case of swine flu. And I think that's a lesson as well.
Yeah, I mean, it's really interesting thinking back to the SARS and swine flu responses because you do get a sense, at least 2-3 years on, where there's an aspect of fighting the last war when it comes to the COVID response.
Yeah, and I think that, the fact that Chinese epidemiology was reformed and deployed to such an extent in that pandemic and then ultimately criticized, that was really kind of interesting and I think difficult for a lot of people working in public health to experience. And I mean, Mason's informants took away two lessons from SARS. First, that they should act with professionalism, with scientifically informed approaches on the one hand, but also that they should really buy into authoritarian mobilization. Yet ultimately, the result was that they felt in some ways betrayed, especially by the international community that they were attempting to be a part of. And I think with COVID, one of the interesting things is the way in which we maybe see greater support for the methods.
The point you were mentioning, Mary, about how vaccination, epidemiological control, and surveillance, all these activities play a really important role in the state building process of China before and after 1949. And there are just like multiple examples. And looking at this today, where we have this interesting situation where zero COVID policy, which is mainly based on a very stringent surveillance program enabled also by digital tools, versus at the same time, there are still gaps in vaccination that the Chinese government is still trying to address.